So today's fertility masterclass is all about optimizing egg and sperm quality. That's me, Dr. Laura von Hagen, naturopathic doctor. And I love this little picture here because we see the pomegranate and then the almonds, and that's kind of the sperm running towards the egg. But these are also foods that I love using to optimize egg and sperm quality, as you'll see later on in this presentation. As I mentioned, you can use the chat. If you want to, let me know where you're coming in from, say hi. If you have questions during it, you can always raise your hand or use the Q&A, but I'll make sure we have time at the end as well to go through all of your questions. And I'll take some breaks in between just to check the chat and see if anything's coming up. So just a little bit about me. I'll keep this really brief. I know I've connected with some of you at the Canadian Fertility Show, which is awesome. Other ones, maybe you found us through social media. So I've always had a big interest in health. I did my undergrad specializing in kinesiology. I went on to do actually a master's where I did an internship with CEDA in maternal and newborn care in Africa. So I've had a really big interest in fertility and pregnancy for a long time. I was an intern on the fertility focus shift when I did my naturopathic medical training. Then I went on to receive my doctor of naturopathy. From then, I've been an award-winning speaker. I presented at several conferences on topics such as sperm quality PCOS, and I'm also the author of My PCOS Pregnancy, which is really a blueprint for anyone who is looking to get pregnant with PCOS. I'm actually an IVF mama myself. I originally had my IVF cycle canceled during COVID, and that's what kind of spawned me to channel all of that sort of frustration into my book. And I talk about my own journey to becoming a mom through IVF, as well as what I did to help manage my PCOS naturally. So this here, I always start off every presentation with a little bit of humor. As we say, people always wonder, don't we just need one sperm? Yes, we need one sperm to fertilize the egg. But ideally, we have lots of sperm because they all kind of help together. And as we'll see, there's a difference between optimal and fine. So yes, we think about things being just fine. I always hear, oh, my partner had his semen analysis, and I said it was fine. I'm not looking for fine, I'm looking for optimal. We want the Michael Phelps swimmers when we're trying to conceive, especially if we're doing something like an IUI or IVF and we're investing, thousands of dollars into that process. We want to make sure that we're really giving it its best shot. And so I'm always looking at how can we really optimize things for patients. So today's agenda, we're going to talk about what actually impacts egg and sperm quality, because there's a lot of misinformation out there. We're going to talk about diet and lifestyle, discuss a little bit about endocrine-disrupting chemicals. And this is a really up-and-coming topic and something that I think we need to be sort of more aware of on our radar as we find out more and more evidence for this, because we're starting to see links between this and certain hormonal conditions such as endometriosis or the growth of fibroids. So we definitely know that we want to be aware of these chemicals in our environment. I'm going to talk about some key supplements for optimizing egg and sperm quality. And this list is by no means complete, just ones that I really want to focus on and really explain why they're the top supplements and why it matters. I get asked a lot, for instance, about ubiquinol versus ubiquinone. And if you don't know what that is, you will by the end of the presentation. And then I'm going to talk about the role of IV therapy and acupuncture and how this can be a great additional therapy, whether you're trying to conceive naturally or going through fertility treatments as well. And this is a really unique offering that we have at Higher Health. We have a full IV lounge. We have multiple suites, private suites for acupuncture. We also do red light therapy, which is a version of low light laser therapy, which is becoming more and more of interest for fertility and helping with cellular health. And so we're really a one-stop shop for all your fertility needs. And I love working with patients and their fertility clinics to make sure they're getting the best care. So what impacts egg and sperm health? As you can see, a lot, and I mean a lot. And really, I was just focusing on the key things that I could fit in one slide. And the reason I want to bring this up is because it drives me bananas when patients come in and they've been told, well, it doesn't matter because all that matters is my age. Or I was told that I couldn't get pregnant because of my age. If I have one more patient tell me, they've been told all that matters is their age, well, I'm going to just, completely lose it. And again, it drives me bananas when I hear this. Because yes, age is one factor. And yes, it is an important factor. But as you can see from this list, it is certainly not the only factor. There are so many other things that impact our egg quality and also our sperm quality. And as you can see, many of these things are what we call modifiable risk factors. So no, we cannot not modify our age, unfortunately. We can't make ourselves younger, but we can modify what we eat. We can work on weight management. We can reduce our alcohol and caffeine. We can stop using recreational drugs. We can avoid excessive heat. We can look at sleep and helping you actually get to sleep. And you'll see why this is so important, especially when we talk about sperm. So I want to really take the emphasis off of age. And as a naturopathic doctor, there are all these other things that we focus on. So for fertility clinics, really when they're doing a one-day workup, especially for a female, they're looking at your AMH and your age and your hormones. And that is one snapshot, and those things are key. But again, those are all just numbers. And those numbers don't mean anything until we actually look at them in context with you as a patient and your overall health. So they're going to be focused on those numbers. I'm focused on everything else here and how do we actually improve the quality of those eggs. And those are the things that we're going to be discussing today. I'm just going to see here, just jumping in to see if there's anything in the chat or questions. And I don't see anything, so I'm not going to worry about that. Oh, sorry, I'm going to click back here, dock to top and close that. So what's next then? So we talk about egg and sperm quality. Well, what exactly does this mean? We're going to go back to science, probably high school science for a lot of you. And remember this, the little mitochondria hanging out there inside our cell? This is what we're really talking about. The mitochondria is really the powerhouse of our cells. And really eggs and sperm, they are what we are looking at when we're looking at that cellular health and the mitochondria. And really when it comes down to the mitochondria, again, you can think of them as batteries, and it takes a lot of energy for an egg to be released, for the egg to be fertilized for the sperm, for it to travel down the fallopian tube, to implant into the uterus, to start to grow and divide. And what can happen is essentially it just runs out of gas, right? Those batteries just get drained. And what we need to do is we really need to charge those batteries. This can be a little bit confusing because I know some patients tell me, but wait, aren't there studies that show that lower egg quality, those eggs have more mitochondria? Yes. And this is the interesting thing. It's not about how many mitochondria you have. It's about the health of those mitochondria. Because when we have poor egg quality, we try to produce more mitochondria to overcome that. So instead, what we want to focus on is recharging those batteries and optimizing the health of the mitochondria. And what mitochondria really like is antioxidants. And what they really don't like is oxidative stress. And that can be like literal stress that you're going through, such as your commute to your job and other things, or that can be stress from a poor diet, from lack of sleep, from some of those endocrine disruptors in our environment. So we really need to focus on optimizing egg and sperm quality by increasing our antioxidant load, reducing oxidative stress to support the mitochondria and sort of health of our cells. And we can see this, maybe you're someone who's gone through IVF, if you're working with a partner, and I always get the question, why is there so much die-off, right? Maybe you started with 10 eggs that were, picked up on your oocyte pickup day, maybe 8 of them fertilized. By day 3, you were down to 4. And then maybe by day 5 or 6, you only had 1 or 2. And it's like, well, what happened? I started with 10. And this is the idea that the gas ran out of the gas tank and there wasn't enough charge left in those batteries. And that's where we come in as naturopathic doctors to really optimize that mitochondrial health to help those embryos make it to day 5 and 6 and be good quality embryos. Interesting thing, again, when we talk about fine versus optimal for sperm health, sperm counts are on the decline all over the world. Globally, it's kind of tanking and we're not looking as good as we used to. And you can see here the World Health Organization, their criteria for what is considered normal. And things have really changed. Like morphology, we used to say you needed 14%, now just 4%. motility, how well that sperm can swim, the concentration, and the actual volume of the semen. And all of this is declining for a variety of factors, and probably the things that we talked about, such as obesity, poor diet, lack of sleep, endocrine disruptors. So all these factors are impacting sperm health, and we're seeing globally this decline. So when I'm looking at things, again, I want to look at optimal versus fine. So maybe you have 10 million sperm and they're like, oh, that concentration's a little low. Well, no, that's way below what used to be. And actually optimal is probably closer to 50 or 60 million. And we can certainly get there. The nice thing with sperm is that the turnover is about every sort of 100 days. That's why I really recommend that preconception care piece. If you're thinking about starting to try to conceive, maybe you're on a wait list for IVF, we really want those 100 days to optimize egg and sperm quality. And absolutely, we can see these changes in these semen parameters and the sperm analysis over that time if we really, really focus and work hard on this piece. And so knowing right now that wait lists are incredibly long for fertility clinics, I'm seeing right now that on average, just to even see the doctor for like a 10-minute Zoom consult, that introduction can be 6 months. We can use those 6 months to really, really work on your health so that by the time you're ready to have that workup or you're ready to do IVF, we've already put in the hard work to really optimize those things, because I want to take you from maybe that concentration of a 10 to a concentration of a 50. Again, we want optimal, not 5, and we want the Michael Phelps swimmers. Another optional test that I often see done is something called a sperm DNA fragmentation test. You would have known if you've had this done because it's not covered by OHIP, that usually costs somewhere between $200 to $300. And we see that high sperm DNA fragmentation can really, damage our outcome in terms of reduced fertilization. We can see poor embryo grading. We see lower pregnancy rates and higher miscarriage rates as well when we see that higher level of fragmentation. So basically, instead of that DNA being nice and tightly coiled, it kind of becomes fragmented and falls apart. And the interesting thing is as well, we see an increased time from what we call an embryo to a blastocyst. So if you've undergone IVF or you're prepping for it, we're looking at, sort of day 1 fertilization, day 3 and day 5. And, usually we're freezing embryos on day 5 or 6 when they've gone to what they call the blastocyst stage. So we need to see that nice blast formation in order for those embryos to be frozen. And what we find is that when sperm DNA fragmentation is actually higher, it takes longer to get there. So instead of freezing your blastocyst on day 5 as a day 5 blast, might be a day 6 or a day 7. Fertility clinics don't really like that. We prefer day 5 or 6 embryos. When we see all of the embryos having to take until day 7 to turn into a blast, that makes us a little bit concerned about egg quality and also sperm quality at that point. And usually those embryos tend to be poorer grade and are more likely to be genetically abnormal as well. The other thing with DNA fragmentation that we might see is a higher die-off rate of embryos. And so when we think about that fertilization, again with IVF, if we see a big drop-off between days 3 to 5, that makes me very suspicious of sperm quality. And so if those patients haven't had their DNA fragmentation test done, and they're doing another round of IVF, I typically recommend doing it because then I know that there's supplements that we can give to help improve that DNA fragmentation. And I've certainly had this with couples before where they come to me and the DNA fragmentation is way over 30 and we're able to bring it down to under 15%, which is optimal. So we're looking for a lower number, meaning less fragmentation. And then those patients have gone on to conceive and have a healthy pregnancy and healthy baby. So absolutely things we can do to change that number through supportive supplementation and diet and lifestyle change. And so I do recommend something to look into that DNA fragmentation test so we can really understand what's going on. I'm just going to grab some water. So hopefully this is going well so far. As I say, if you're a little bit overwhelmed and totally confused, don't worry, you can always rewatch the webinar, or if you think you need some more of that one-on-one personal support, you can connect with me to do an individual consult. I also offer a fertility couples assessment. So if you're working with a partner and we want to work on eggs and sperm quality, that's when we can really go through things. And I know when you're going into a fertility clinic, it can be a bit of like a deer in the headlights. Like I say, I've been there. I remember it was this kind of rat race running to appointments in the morning, and it can be very overwhelming with the amount of information they give you. And now, having gone through IVF myself and working with patients, I can really help educate and support you along the journey, because that can really, take a lot of the stress out of a very stressful situation. So speaking of stress, sleep and exercise, because certainly when we're stressed, we tend to not sleep as well. Sleep is very key, and we know that less than 7 or more than 9 hours can negatively affect sperm. And this is because testosterone production actually peaks at night. It's a bit of a nocturnal hormone, and we need that testosterone production to help with sperm. And so men who don't sleep as well tend to have lower levels of testosterone and lower sperm counts. And you're probably wondering, well, wait, I understand not getting enough sleep, but what about the more than 9 hours? Well, sleeping too much can also be a sign of depression, and depression is also a risk factor for male infertility. So if we're seeing that you're, excessively sleeping all the time, we might want to look at that mental health piece as well. But certainly if you're sleeping less than 7 hours, having trouble falling asleep, going to bed too late, sleep hygiene can be really important. So for sperm, something we want to look at. The other thing that's really interesting is melatonin. And this is actually one of my favorite things. And it's actually a really good antioxidant. So it's something that I'm using quite often in terms of looking at egg quality as part of a fertility care plan that I put together for patients, but also looking at how can we naturally boost levels of melatonin. And we see increased levels of melatonin has been correlated with higher levels of progesterone. So that sleep quality, directly impacts our hormones. And that progesterone is so key for helping with implantation and supporting pregnancy in those early stages. If we don't have enough progesterone, that can be a risk factor for miscarriage. And that's why with fertility clinics, we're often putting patients on progesterone. And for myself, having written my prescribing exam, sometimes I'm even prescribing progesterone to my patients during their pregnancy in the first trimester to help support it. And so we want to look at sleep. We want to maybe potentially consider supplementing with melatonin, but also trying to help increase your own production of melatonin by looking at sleep, so that we can help raise that progesterone, which we need to kind of maintain that uterine lining and support implantation for any potential pregnancy. The other thing I get asked about a lot is exercise. And I always hear, but wait, I heard too much exercise is bad for me. Can I exercise while I'm trying to conceive? Do I have to do yoga? Do I have to do that? What's sort of like the best type of exercise? I will say yes, too much exercise is bad, but rarely do I see this in practice, especially now with COVID because gyms are closed. For every maybe 10 patients I'm trying to encourage to exercise more, there's maybe one that I go, maybe we should cut back on your exercise. So how much is too much? It's kind of like sleep, really we're looking at more than 5 hours of strenuous exercise per week. And I'm talking very heavy intensity, like an extreme CrossFit or running 10 kilometers on most days of the week, which I'll be honest, a lot of us don't do. I definitely don't do that. And that's because if we're having too much exercise as a female, that can impair ovulation because perhaps our body fat percentage will drop too much. Or for a male, too much exercise, if you're producing a lot of heat, that heat can be damaging to the testicles, like if you were doing a lot of cycling. So in general, I'm really trying to encourage people to exercise more and pick something that you like, because if you like it, you're more likely to do it. And yes, you can exercise while trying to conceive. During IVF, we do need to be a little bit more careful, especially when you're undergoing stimulation, when you're using like your injectable medications. That we need to definitely be cautious because there is always that risk of ovarian torsion as we're really kind of ballooning those ovaries with a lot of follicles. But in general, if you're trying to conceive and you've been previously active, you can continue to be active. And really, would I be concerned about too much exercise? Only if you were a female and you started skipping periods, or suddenly you lost your menstrual cycle, or as a male if it was, something that was causing a lot of heat. Can melatonin be measured? I just have a question here from Mary, so I'm going to say it to everyone. There was a test in Canada called the CHI that was a comprehensive hormone insight, and it was a dried urine test that looked at melatonin. Unfortunately, with COVID and issues with supply chain and production, that test no longer exists. So as of right now, I don't have a good way of measuring melatonin, but I can get a pretty good idea just based on looking at people's sleep habits and doing like a really good sleep diary. And we know sort of what level we need to give for patients. So the dosage that I'd be recommending for someone for egg quality, for instance, is different than what I'm recommending for someone with endometriosis. And so we know based on the research how much we should be giving, which then, do we need to measure it? Not necessarily, if we can just follow the data and what the studies say. Just got to click back here. So speaking of exercise, then that brings me to BMI. And really, I'll be the first one to say, BMI is not a perfect science. For those of you who are not familiar with it, BMI stands for body mass index, and it's a way of looking at your weight to your height to assess kind of, are you within a normal range for your body weight? And as I say, it's really not perfect. There's definitely fraught with errors. It doesn't take into account body fat percentage versus free fat percentage versus lean muscle. So it's a best guess at most. So we can use it to kind of look at overall health. But again, it's like a lot of things. It's just a number, and we need to look at it in context of you as a patient. So if I'm talking about really more, extreme end, so really high or really low BMI, certainly then we know that there can be some things to consider. So in males, the problem with a higher BMI is that it, added adipose tissue, so that fatty tissue surrounding our organs, can actually heat up the sperm. So that's why testicles and testes are outside of the body, to keep the temperature lower. That sperm really doesn't like heat. And when we have a higher BMI, there's just like an extra layer of fatty tissue insulating the testicles, and that can raise the scrotal temperature, and this can lead to erectile dysfunction. This can increase the level of estrogen that we have. This can cause sleep apnea, and that sleep apnea can then impair testosterone, which can impair sperm. So certainly we want to be focusing on bringing it down to that normal range of a BMI for males, to help with sperm health and also just help with overall health. Now let's look at females. We actually see obesity, which is a disease, can be a cause of oxidative stress on the body. So just having that added fatty tissue can increase some of those inflammatory markers, increasing the oxidative stress. And as I say, we're always trying to bring on more antioxidants to protect our mitochondria and reduce some of that inflammation and oxidative stress. So with women with a higher BMI, we see, higher rates of miscarriage, but lower actual live birth rates. We see higher rates of anovulatory cycles, and this is especially true for PCOS. As I say, I have PCOS myself, so it's something that I see a lot of in practice. And when we're looking with PCOS, we do know that weight loss for certain individuals can really help because it can get the body ovulating again. But the kicker is we're looking at 5 to 10% of body weight. So not losing 50 pounds, maybe, 10 to 15 pounds, right? And I'm not saying that that's easy. Weight loss is really hard, but by no means am I trying to, get you down on some crazy low calorie diet to lose 50 pounds in a few months. We want slow and steady weight loss. And if we can even just lose 10 pounds, that can restore your ovulation, which we need to get you pregnant. We also see that negative correlation where if we have a higher BMI, we see a lower AMH, and AMH is our marker of ovarian reserve. And then on the flip side, a really low BMI and low body fat percentage can prevent ovulation. So if our BMI is too low and we don't have enough body fat, then our brain kind of goes, whoa, 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 food is scarce. There's a lot of stress going on. This is not a good time to bring a baby into this world. And that can actually stop the body from ovulating as well. So as I said, not a perfect science, but we are looking for that sweet spot. And I just see I have a question here in the chat. How does melatonin help with endometriosis? Very good question. So melatonin, even though it's a hormone that helps with sleep, it's actually also an antioxidant. And we have receptors for melatonin in our ovaries and in our uterus as well. And as an antioxidant, it can help with the pain due to endometriosis. It can help with disease progression. So it can actually help slow the progression of endometriosis. It can help with egg quality, which can sometimes be damaged by endometriosis. And it can help balance our hormones. So it can actually help lower FSH and bring our hormones and egg quality into a better balance. So it's something that I would absolutely be recommending for my patients with endometriosis as part of their care plan. And we'd be kind of looking at what would be the best dosage and form. We can get different types of melatonin. There's sustained release on the market. There's liquids, there's gels, there's sprays, there's prolonged release. This is where, again, people come in and they're very confused and going, I don't know what to take. I went to the sleep section and there's 20 melatonins. That's okay. That's my job to tell you what to take. We are the experts here on supplements. And so putting together that customized care plan to make sure we're taking the supplements that are, one, appropriate for you, but also going to actually make a difference. Because, you know, we do see with certain brands, we see better results. So it's my job to really help you put together that care plan and take out the guesswork. I just see there's one more question here. Yeah, so what would be the best? So melatonin, as I say, really, it's totally individualized on how much to take. It could be anywhere from 3 to 15 milligrams. And so that would really be based on individualized. All of our treatment plans are personalized to our patients. And that's something that we go through in the fertility care plan. The best form, again, depends on the patient. Sometimes I'm using sublingual, sometimes I'm using a spray, a liquid, sometimes I'm using a sustained release. So I really look at your sleep habits and what your goals are. And so I'm never just using one melatonin supplement. I'm often recommending different brands or different forms based on what you need as a patient. So on to endocrine disruptors, I'm just going to do a time check here. Great. As I say, I try not to keep you too long. So this is a really up and coming field and something that I'm very interested in as we find more and more about, because I remember talking about BPA like years ago. Oh gosh, this would have been like maybe 6 or 7 years ago when I was an intern. And, you know, the BPA was like really just starting to kind of come over. And we're thinking about, you know, how are these things in our environment like plastics impacting my egg quality and my fertility? And so first we're going to talk about phthalates, and phthalates are actually something that are found often in perfumes. It's like a scent. And the hard thing with phthalates is they might not be listed as a phthalate. It might just be listed as fragrance or a perfume. And the problem is, and again, it's a little bit hard to measure in the data. We're kind of looking at correlation studies, but we see abnormal sperm quality with higher levels of phthalates in the urine. And they've also been associated with poor egg and embryo quality. So when we measure the urinary phthalates in patients undergoing IVF, we see less oocytes, we see less mature oocytes, and less quality embryos in an IVF cycle. And so phthalates are something that I'm really trying to remove from my patients and take them out of their environment. And so this is where we kind of do a 360 review of your home as part of that fertility consultation, looking at your beauty products, your makeup, your body lotions, your shampoos, your body lotions, you know, where maybe these phthalates sort of hidden that you might not be aware of, and how can we replace those with more natural products? They're going to have less of these endocrine disrupting chemicals. The other one, the big one, is BPA. And really, if there's anything I would say to try and avoid, it's going to be BPA. As I take a sip of my glass of water here. So BPA is bad, really bad. And part of the problem is because it really can bind very tightly to things in our body. When we have something like estrogen and we have a receptor for estrogen, estrogen can kind of come in and out of the receptor, you know, kind of going on and off as we do. BPA comes slamming in and binds, and it binds tight, and it doesn't let go. and it can mimic those estrogens in our body, but much more strongly. And this can really cause some hormonal imbalances. That's why we see BPA being tied to things like breast cancer and reproductive problems. We also see BPA as an obesogen, meaning it turns on genes associated with obesity. If there's that prenatal exposure, that can actually decrease fertility in the offspring. So we see that being passed along. And specifically in males as well, again, looking at levels in the urine, we see issues with low libido and erectile dysfunction, probably because it's mimicking estrogens in the body and increasing that estrogen to testosterone ratio. So I always get asked or get told, well, it's fine because my plastic water bottle is BPA free. Here's the thing. So even if we take the BPA out, all we do is replace it with other chemicals, which arguably are even more harmful, and we just haven't done enough studies on them yet. So even though it's BPA free, it probably contains BPS, which is just as harmful, if not worse for us. So we really want to avoid all plastics and use glass containers instead. The big thing as well for BPA is when you heat it up, because heating it up directly leaks that out into our foods. So you know what, and maybe you need to use the occasional Ziploc to throw something in, but if you're looking at heating up like a soup or a leftover, definitely using those glass containers in your microwave or heating it up in the stove or the stovetop, and then looking at water bottles, using a glass or stainless steel instead, so that we can really minimize that plastic use. So moving on from BPA to everyone's maybe favorite or not so favorite topic is, what should I be eating? And this is by far the thing I get asked the most about in clinical practice, because again, it's very confusing. Dr. Google, Instagram, media influencers, people going, I don't know what to eat. What is the best diet when I'm trying to conceive? And, really it comes down to some of the latest research. And yes, you're going to see the Mediterranean diet is important, but there's new evidence for things that are more important than the Mediterranean diet and what I really am telling my patients to focus on. So what do we know? First and foremost are good old fruits and vegetables. So if we think of that kind of Canada's Food Guide or the Mediterranean pyramid, fruits and vegetables should be making up the bulk of the base of that pyramid and what you're eating every day. I'm talking 5 to 10 servings of fruits and vegetables. So what does that look like? You're probably having a couple pieces of fruit throughout the day, maybe in a smoothie or as a snack. And then when it comes down to lunch and dinner, at least half your plate should be vegetables. So we really need that emphasis on fruits and vegetables. And yes, you can do frozen. You can do frozen berries in your smoothie. You can add frozen cauliflower to your smoothie. Trust me, it's delicious. Give it a try. You can use frozen veggies. We just need more fruits and vegetables in the diet. Fiber and whole grains, trying to bring in those lean proteins like fish and seafood, and healthy fats from things like nuts and olive oil. So then what are we wanting to avoid? We really want to avoid processed foods. And processed foods is anything that's really been kind of packaged and baked, because we know too, cooking things at high temperatures, like a cracker or a cookie in a box, also increases these advanced glycation end products, which can further worsen our fertility. So we want to avoid the rice cakes, the cookies, the crackers, the croissants, the packaged store-bought muffins, any of those things that are sort of packaged and processed that contain a lot of additives and unhealthy oils, and often a lot of sugars. So people always think about sugar in their coffee. I'm more concerned about the sugar in the store-bought muffin or the granola bar, because even the granola bar, I can tell you probably the first ingredient is going to be sugar. We want to bring down the coffee and alcohol. We want to watch, carbohydrates. Potatoes, funny enough, comes in there because people just tend to overeat them. Refined carbohydrates, so like our white breads and our white flours, our sweets, and fat-free dairy. So fat-free dairy, funny enough, full-fat dairy actually hasn't shown to improve fertility, so like a 2% Greek yogurt, whereas fat-free dairy, not so much. And probably because a lot of those fat-free dairies are just full of sugar. So reaching for the plain dairy products instead can be helpful. I'm just going to see. Of each year together. Sorry, 5 to 10 servings total of fruits and vegetables. So typically I'm trying to recommend around 7 servings of vegetables and 3 servings of fruit. So maybe you have a big smoothie, half veggies and half fruit in the morning. an apple with some nut butter in the afternoon, and then your lunch and dinner, you'll make up the rest of those vegetable servings by making half your plate vegetables with then a complex carbohydrate and a source of a lean protein. So, like I said, move over Mediterranean diet. Let's chat glycemic load. So for the longest time, the Mediterranean diet was sort of the fertility diet because it had been shown to improve IVF outcomes. And I will say that's still the case. The Mediterranean diet is important, but the component that's important to the Mediterranean diet is really the glycemic load in terms of the carbs that you're eating, how sugary they are, and how much do they spike our insulin levels. And we know that if we don't have good glycemic control, so we have insulin resistance and we don't handle and keep our blood sugar under control, this can be a risk factor for infertility. We see a high glycemic diet can impair ovulation, especially in women with PCOS. And things that are high glycemic, again, are those things that are packaged and processed. So croissants, muffins, white bread, white rice, a lot of breakfast cereals or granolas on the market, granola bars, any of those sort of like snacky foods. And there was actually a study where they looked at this and they saw that a higher intake of snack foods was associated with more infertility. Whereas when we look at that Mediterranean diet, it's not saying don't eat carbohydrates, it's saying eat the right carbohydrates. And we know just even something like whole grains, so having like in the photo here, 100% whole grain bread, we see a greater endometrial thickness, which can be helpful for implantation, and we see higher pregnancy rates. So I'm always looking at how can we add more fiber into the diet. So reaching for that 100% whole grain bread, choosing something like a quinoa or a wild rice or sweet potatoes, maybe a whole wheat couscous or something like a chickpea or lentil pasta. So upping that fiber content and having more of those whole grains can be really key. And as I say, we want to watch out for that intake of added sugars. So this here, one of my favorite breakfasts, avocado toast, great. Have some Greek yogurt or egg on the side for protein. You're getting all the nice things that we want, those healthy fats, that fiber, and those lean proteins as well. So nutrition 101, if you're like, that's awesome, where do I start? I really want to focus on things that we put into the diet versus taking everything away, because often you're already feeling very deprived as a patient, especially if you're going through IVF, because you're on these millions of pills, you're avoiding all these other things, and it's like now you have all the stress, and it's like I want to take the stress out of this process as much as I can. By not making it seem like you're on a restricted diet, but focusing more on, okay, what are the key things we want to choose? So this is where I love stuff like beans, because beans are really high in fiber and antioxidants. So maybe instead of having like a baked potato with your dinner, have a nice bean salad. Berries, really antioxidant rich, really low sugar, really low glycemic, high fiber. So berries can be wonderful, either fresh or, like I say, in the winter time, doing frozen in a smoothie. Vegetables, really eating the rainbow, our beets, our green leafy vegetables, our cruciferous vegetables, and then nuts. So having more of those healthy fats in our diet. So our walnuts, our almonds, Brazil nuts. I'll put pumpkin seeds in there, even though they're a seed, our olive oil. So bumping up that antioxidant load and bringing out more of those processed foods is a great place to start. So, which brings me then to some of my top supplements for fertility. Hang in there. I promise you I'll wrap up by 8 p.m. and save some time for questions. Let me go through some key things that we're looking at. So vitamin D, even though it's technically a vitamin, it acts more like a hormone in our body. And we see that the prevalence of vitamin D deficiency is actually higher in women who have been diagnosed with infertility compared to the rest of the population. This can be as high as 65%. And it's not just important for eggs. Deficiency is also associated with decreased sperm morphology and motility. And we know that adequate levels has been shown to reduce the risk of miscarriage. And there was this really great study that showed for every point that we increase vitamin D, so just bringing up that vitamin D level by 1 point, decreased miscarriage rates by 1%, which is insane. If there was a drug that did that, like that would be like a, what's the word? Knockout home run medication that every doctor would be over. And here we have something vitamin D, cheap, easy, and accessible. Increase it by 1 point, decrease miscarriage by 1%. Very, very simple. We also find that AMH, this link between vitamin D and AMH. So low vitamin D, low AMH. So actually in the wintertime, we see that AMH levels are lower, and this can drop by about 18%. And as I say, AMH is a marker of ovarian reserve. It does not measure egg quality, but a higher ovarian reserve, you might think that there's potentially better quality follicles around. And we want that higher AMH level, especially for IVF, because it's also a bit of a surrogate marker for maybe our antral follicle count and how many eggs we can expect to retrieve. So we're always looking for ways to optimize AMH. And AMH, yes, is something that I've seen change, and I have seen go up in patients when we really work on their overall health and optimize their vitamin D levels. So the key thing here, as I said, is all of this has to do with deficiency, but just simply increasing vitamin D will not bring on these things. We have to actually get you out of deficiency, and we don't know if you're deficient unless we test. So this is something that I'm a really big stickler for when it comes to test, don't guess. I know we had talked about melatonin earlier, and there isn't a great test for that. Vitamin D, it's a simple blood test, and we will know pretty quickly if you're deficient, and that can help me determine how much to give you. And people go, well, I'm already taking vitamin D. Even today, I had someone who was already on 3,000 IUs of vitamin D, so like pretty high dose, above kind of the general average. Her vitamin D was 50. Then for those of you wondering, that's low, like super low. We want it over 100 for fertility. The normal range in Canada is 75 to 250. For fertility purposes, we want between 100 to 150. So even though she was taking vitamin D, it was not nearly enough for her. And so it is something that I'm always testing in my fertility patients because I want to bring it up to optimal range. The other biggie is CoQ10. And so for anyone listening now, I'm sure you've heard of CoQ10. I want to tell you a little bit about its little sister PQQ, which is also very important. So CoQ10 and PQQ are both antioxidants, and they're actually kind of concentrated in the mitochondria. And CoQ10 was sort of like the first big thing for egg quality. When I started treating patients back in 2016, I was sort of the one telling them to be on CoQ10. Now a lot of my patients come in on CoQ10 because fertility clinics are recommending it. They're coming around to how this can help with egg quality, help with embryo development, and help with clinical pregnancy rates. So the dosage for CoQ10 is somewhere between 200 to 800 milligrams per day. Most studies are looking at around 600, but not necessarily everyone needs to take that much. For sperm, we could probably get away with a lower amount. For PCOS, probably a lower amount. Whereas when we're looking specifically at egg quality, we're looking to get to kind of that higher range, probably around the 600 to 800 mark. And again, this is where I find a lot of patients come in on CoQ10, and they're either not taking enough of it, they're taking it all together, which we want it in divided doses with food for better absorption, or they're taking the wrong form. There's a lot of talk about ubiquinol versus ubiquinone, and I mentioned this a bit earlier, and I told you by the end you'll know what that is. So ubiquinol and ubiquinone are the two forms of CoQ10, ubiquinol being the active form, ubiquinone being the inactive. Ubiquinol is way more expensive, but here's the thing, in the body, it goes back and forth between both anyways. It's kind of doing these oxidative redox reactions where it's flipping, it gets kind of converted in our digestive system, it gets converted when it goes through. So, and a lot of the studies don't differentiate ubiquinol versus ubiquinone. So I'm not as concerned about which dose, which form of CoQ10 you're taking. I'm much more concerned about the dose and whether or not it's actually in like a soft gel and an oil base, because as a fat soluble antioxidant, you do need that fat to absorb it. So this is where brands and dosages do matter, and working with a naturopath to make sure you're taking CoQ10 appropriately. The other thing we want is some PQQ, because they kind of work in a synergistic manner to increase mitochondria activity and efficiency. So if we're trying to look at maybe, can we bring down the amount of pills you're taking? Because it can be a lot of pills when you're undergoing IVF. We can maybe get away with a bit lower dose of CoQ10 if we're adding in that PQQ as well. So I'm often using these together. As I say, we do want to take them with food. Don't necessarily need to take ubiquinol, but need to make sure that you're taking the right dose of these. Omega-3 fatty acid. Talked about this a little bit in diet. So I'm always encouraging it through diet. But sometimes I will reach to a supplement, especially if people are like, you know what, I hate salmon. I can't do it. Nope. Don't want to eat sardines. No, I can't do it. Then I'm like, all right, that's fine. We can do a fish oil. I love salmon, so I'm looking at this right now, and this is making me hungry. But if you're those people who's just like, I freaking hate fish and I'm not eating it, that's okay. We can supplement with a fish oil and help. And we know that when we have that higher dietary intake, and this we can actually measure, we can measure the amount of omega-3s in your blood in that ratio, we see improved IVF outcomes. They can help with healthy blood flow. So if someone who has a thin lining, we can give a really high dose of omega-3s to help support their lining. And we really want to skew that ratio. So we know that more omega-3s, which are things like our fish and our nuts and our seeds, are going to optimize IVF, whereas omega-6s, which are more inflammatory, can negatively impact. And you're probably thinking, I don't eat a lot of omega-6s. I don't use those things. Canola, the sunflower, the safflower, the soybean, all of those oils are often, again, in those processed foods. So if you've ever looked at the label of a salad dressing, a granola bar, a cookie, a hummus, I guarantee you one of the first two ingredients is going to be something like a canola oil because they're cheap. So you're probably getting way more omega-6s in your diet than you actually think. And if we go back to more home cooking and less processed foods, that's when we can use our olive oils and increase more of those omega-3s, maybe doing a salad dressing with a flax oil, adding some walnuts on your salad, eating wild salmon or trout a couple times a week, sardines if you can stomach them. I know that can be a bit of a hard sell, but certainly adding in those omega-3s and potentially supplementing as well. Great question here, Miriam. Is CoQ10 and PQQ also important for an FET? So FET is a frozen embryo transfer. So in the case of a frozen embryo transfer, where the embryo's already been frozen, put away, and now we're just thawing it, I don't use as much CoQ10 and PQQ because those are more for egg quality. Occasionally, I've maybe kept patients on CoQ10, and I will kind of continue that and slowly wean them off of it if we're looking at some lining support and maybe some underlying inflammation. So there are cases, but most of the times those things like CoQ10 or PQQ, you would be stopping after your egg retrieval, and then we would be revamping and kind of fine-tuning your treatment plan for your FET. So things I'm recommending in terms of supplements for an FET are very different than someone who's about to have their egg retrieval. And that's where we're kind of personalizing it based on what your needs are. Okay, acupuncture, not just for women. I love acupuncture. I was doing weekly acupuncture myself when I was going through IVF, and actually continued it all the way through, my first trimester. It helped me with nausea, helped me with sleep, helped me, with kind of relaxation. So acupuncture, we think about it for the woman a lot of times, but we can also see in some studies that I put here that it can help with sperm health as well. And so I'm often trying to encourage partners to come in, and especially if we know that there is a male factor and low sperm, then I'm potentially looking at, having the partner come in for acupuncture. So something to think about. Acupuncture, as I said, the reason I want to focus on men is because there is so much information out there on women. We know that when women are doing acupuncture, we improve blood flow to the uterus. We can help with follicular recruitment, can help reduce stress, which can negatively impact our fertility, can help reduce miscarriage rates. It can help with pregnancy rates when undergoing IVF. And so certainly acupuncture weekly sessions is something that I'm recommending when patients are trying to conceive or they're in an active IVF cycle. But don't forget about the men. Sometimes you might need it too, leading up to maybe that round of IVF if we're trying to work on sperm quality. And the last thing we're going to talk about is the IV vitamin therapy. And as I said, this is something that's quite unique to higher health. There's only a few clinics that offer it because it does require advanced training for us as naturopaths. Miriam, I see your question here on thin lining. I will answer that at the end because I just want to make sure we get through the IVF, and then I'll go through that as well for you. So don't worry, I won't forget about you. So the IV vitamin therapy, I'm often using IV vitamin therapy for a couple of reasons. One, for patients with endometriosis, because I find that the magnesium can really be helpful with the pain. And the other one is to support egg and sperm quality. So, and I'll be doing this in an active IVF cycle. So even up to the day before someone's egg retrieval, I'm recommending adding in some of our IV therapy to help support that egg and sperm quality. And as you can see here, here's a list of some of the key ingredients in our fertility IV formulas. And these are proprietary formulas that we've developed over time as we've seen help support patients. And I've certainly had patients who've maybe had a couple failed rounds of IVF. They come in, we get them on a really good care plan, we add in the IV therapy, and it turns out to be their best cycle yet. So that's what I'm always looking for, is how can we make this your best cycle yet? How can we really, really hone in on the egg and sperm quality to really support you and make sure that we're putting forward all of those antioxidants. And the nice thing is that when we're doing things intravenously, because we're bypassing digestion and going directly into the veins, this is going right to your cells. We don't have that loss through our digestive or through the breakdown of our liver. And we can give things that I might already be giving in an oral form, but to give that extra boost. So we'll do our B complex, like I say, that magnesium, which can help with endometriosis, that carnitine, which carnitine kind of acts as a shuttle to get CoQ10 into our cells. Our NAC, which I'm using for thin lining, which I'll talk about at the end here, Miriam. Selenium for our thyroid, zinc, which is important for sperm, and then vitamin C, which is, really the most powerful antioxidant to reduce some of that oxidative stress. And, so these are the things that we're working on. And the frequency depends again on the patient, but usually I'm trying to get in a couple IVs, maybe once a week for a few weeks before their IVF. We'll also be working on their supplements, diet and lifestyle, and some acupuncture as well. And I find that patients just feel better after the IV. It gives them a good energy boost. It's relaxing. You get to sit in our beautiful IV lounge. Definitely follow us at Higher Health Center on Instagram. You'll get to see photos of our space. We really try to make it as relaxing as possible for patients. And so this is a nice way to really get in some of that self-care and give that little bit of boost. The other reason I like IV therapy is when people come in and they're like, well, I start IVF like next week. So we're on a short timeline and we're like, okay, what can we do to really boost things fast? Then I'll say, let's get on the IV therapy because we want to really give as many nutrients as we can in this condensed time. Okay, so I hope that helps. Thank you so much, everyone. I'm going to stop and end the recording now. As I say, if you have more questions, please reach out. You can book that complimentary phone consult, or as I say, that full fertility assessment. I'd be happy to work with you, and have a great night.